Hi, everyone, and welcome back to Heal the Divide, the podcast where we explore deep inequalities in our healthcare system and spotlight the voices working to change them. I'm Danya Ramanathan, and today we're diving into a topic that often gets overlooked: dental care. Our guest speaker today is Ash, a passionate dental professional and an advocate for equity in oral health. Ash, thank you so much for joining us today.
Yeah, of course. I'm so glad to be part of this initiative.
Let's start with a little bit about you. Can you tell us about your background, why you decided to be part of this episode, and how you're getting involved in dentistry?
Yes, so my name is Udgirkar, and I'm an incoming freshman at UT Dallas studying healthcare studies major, and I'm on the pre-dental route. I have experience as a medical assistant, lead dental assistant at Family Dentistry of Frisco, and three consecutive 400-hour medical internships at Shailaja Hospital in India. I'm also a martial arts instructor, run my own nail business currently, and am a software engineer trainee. So I actually started out as a nail tech. And I've always loved doing stuff that's artistic and very hands-on. But at the same time, I also wanted to work in the healthcare field and help people in like a real way. And dentistry felt like a perfect mix of those two since it had its like artistic side to it and you're directly helping someone feel more confident with their smile. So currently I'm a lead dental assistant at Family Dentistry of Frisco. I'm certified and registered, which means I help train new patients and basically keep everything running smoothly in the back. I wanted to come on this podcast because I've seen a lot of inequality in the dental field, and it's not just with patients, but even like with staff members and people that work in the office. And I think it's definitely a topic that needs to be talked more. And as for joining the Heal the Divide podcast, I was honestly very excited because it's part of a new organization that's trying to create a real change in healthcare inequality. Even though it's just getting started, the mission behind Heal the Divide really spoke out to me. It's all about lifting up voices that don't usually get heard and bringing attention to gaps in care, especially in areas like dental care that people don't always think about when they talk about equity.
Yeah, thank you for sharing. That's very powerful. Was there a specific moment that first got you thinking seriously about equity in dental care?
Yes, actually, there was a specific moment that happened a few days ago. A new assistant joined her team, and she was really struggling communicating with the patients due to the language barrier since she didn't really speak English well. And I remember hearing one of the doctors say, "Oh, Ash will be a more successful dentist because she doesn't have a language barrier." And I feel like that really stood out to me because it wasn't just about how skillful she was, it was about the fact that she had a harder time communicating. And instead of helping people, people just assumed that she couldn't do the job well. And it made me think about how patients probably don't realize how much of an issue that is either. Plus, the same doctor that also said patients are most likely to like trust male dentists over female ones, and I feel like that was so frustrating to hear. It made me realize how much harder it is for women, especially women from diverse backgrounds, like how hard they have to work to be taken seriously in healthcare fields.
That's unfortunately really heartbreaking and unfortunately not uncommon. So, can you describe what access to dental care looks like for underserved communities today?
Yes, it's actually really hard to get access and it's pretty rough, honestly. A lot of people in underserved areas, they just don't go to the dentist unless it's an emergency or like their tooth comes out or it's like very severe. Some don't even have insurance, they don't have transportation, and a lot of people just don't feel comfortable or like welcome in those spaces. It's not really set up in a way that makes it easy for everyone to get care and access, especially if you're not familiar with the system or speak another language, especially.
Yeah, informing others is definitely really important to solve that issue, as well as there are a lot of issues with insurance when it comes to underserved communities. So, what are some of the biggest obstacles people face when trying to get even basic dental services?
I mean, number one is definitely cost. Dental work is very expensive, and even without insurance, it's almost impossible for a lot of people to pay. But there's also fear, past experiences, and even just not knowing what help is out there. And like I mentioned before, if someone has a language barrier, that's like another huge thing. They might avoid going altogether because they don't feel understood and welcomed.
Yeah, so how does the lack of dental insurance really impact oral health outcomes in these marginalized communities?
It's really just like a cycle. People avoid going to the dentist because they can't afford it. And then by the time they do go, things are like way worse than they needed to be. It leads to infections, extractions, implants, and so much more pain that could have been prevented. And once people lose those teeth, or go through that, it affects their confidence, their ability, or even the job opportunities sometimes. So like it's just like all connected.
Yeah, everything being super connected is definitely important to realize. So, have you seen any creative or community driven solutions that are helping close these gaps?
Yeah, there's actually been like mobile clinics that go around in neighborhoods and schools, which I think is incredible because there's also some communities that also set up free dental days. I feel like the more we bring care directly to the people instead of expecting them to find a way to us, the better the outcomes are.
Yeah, definitely. Is there a story or a patient experience that really stuck out with you? Someone whose situation highlighted these inequalities?
Yeah, there actually was this one patient who came in with a really bad toothache. She had been in pain for weeks, but didn't come in sooner because she didn't have insurance and she didn't speak much English either. I ended up helping translate and just try to make her feel as comfortable as she can. And after her appointment, she told me it was her first time she felt so understood and someone actually listened to her. And I feel like that experience really stuck with me because no one should feel ignored or dismissed just because of a language barrier.
Yeah, definitely. Really agree with you on that. So, how do you think the dental field can do a better job of serving these communities that have been historically overlooked?
I think it starts with hiring more diverse staff, people who understand the communities they're serving, especially. Also, just being more patient and open-minded with patients. Like, not everyone grew up knowing how to navigate in healthcare systems, and or they don't speak English. A lot of people, their first language isn't English. We need to make clinics feel more safe and welcoming, not just for patients, but also for the staff.
Yeah, definitely. I agree with you on that. So, what role do you think education for both patients and providers plays in building a more equitable system in general?
I feel like it plays a really significant role because patients need to know their options and how to take care of their oral health, and providers also need to be trained on how to actually listen and understand to the patients, especially from the ones that are from like different backgrounds. I feel like it kind of goes both ways. The more we educate each other, the more trust we build.
So, imagine you had an ear of a policymaker. What changes would you push for to make dental care more accessible for everyone?
First, I would make dental care part of basic healthcare coverage because it's not an extra coverage, it's like a necessity. I'd also push for more funding for community clinics and maybe programs that support people who want to work in dental, but they don't have the resources or funding for it, especially people from underserved areas, because I feel like they get it. Once they get it, they'll go back and help their own communities and spread the dental care.
Yeah, that does seem like really good solutions to implement. So, looking ahead, what gives you hope when it comes to creating more equity in dental health care, and what can listeners do to help?
What gives me hope is seeing more people talk about this stuff because I feel like it isn't as like popular. And also having these conversations is already a big step. I also see assistants coming into the field who want to make a difference, who notice these problems and also don't ignore them. And for listeners, I'd say support clinics that serve low-income areas for sure, and advocate for better healthcare policies and just be kind overall. Whether you're a provider, a patient, or like someone in between, treating people with respect goes a long way.
Definitely agree with you on respect. Ash, as we wrap up here, thank you so much for sharing your experiences, your insights, and your heart with us today. It's clear that equity in dental care isn't just a professional issue, and it's a deeply human one. From
Mhm.
barriers to access and a lack of insurance to the stories that stay with you, today's conversation has shown us how urgent and layered this issue really is. But it's also been really inspiring to create about to hear really hear about the creative and community-driven solutions taking root and the role we can all play to make change. As we wrap up, one thing that really stands out to me is that oral health isn't healthcare, and every
Mhm.
oral health is healthcare, and everyone deserves to smile, speak, eat, and live without pain or shame. And to our listeners, if this conversation moved you, don't let it stop here. Share this episode, talk about it, support local clinics, and push for policy change. And most importantly, listen to the people and communities whose voices we've been ignoring for too long. You've been listening to Heal the Divide. I'm Danya Ramanathan, and we'll see you in the next episode as we continue to explore how we should build a healthcare system that truly serves anyone and everyone. Thank you so much for listening in today.
Thank you so much for having me. Executive for our medical internship at Sharjah Hospital in India, and I also am a martial arts instructor, run my own nail business.
Wait, can you stop?
Hi, everyone.